So as always, we have a trauma impaled object. We want to make sure we've got our PPE on. We do have scissors in an arm, so in this case, we really need to make sure our scene is safe until we're able to assess our patient and find out what happened. But to start, we will end up taking gauze. We do not want to remove this object unless it ever impedes with our airway and being able to ventilate a patient, or it's in their chest and it interrupts whether they're breathing or CPR, our ability to do either. We will stabilize with gauze. We like to wrap around it and do the best we can to really stabilize that object and help stop any bleeding. We're going to take roller gauze. We're going to start rolling to help stabilize the object. And you want to kind of go back and forth, maybe 2 at a time or 1 at a time, and that helps stabilize the object in place. And typically there's a lot to these rolls, so you don't always need to use the entire thing. It just depends on to what degree. Once your object is stable, you can go ahead and cut this off or tape when it's down small enough, you can help use that to stabilize, and you use some tape to wrap around it and keep it in place. We need to just be able to make sure that nothing is going to bump it and wiggle it and possibly move it out of place that it was originally in and end up causing more damage. As well, once we really wrap up and everything, we want to make sure we check our CMS, checking the pulse, distal, if it's in an extremity. We can check both our cap refill and sensory here and have them wiggle. And that's it.